Hi everyone, my name is Lindsay Bastian and I'm a third year environmental engineering and global health student here at Arizona State University. And today, for the next 5 to 7 minutes, I will be giving a brief presentation on HIV treatment. So if at any point during the session you have any questions, please feel free to unmute yourself and go ahead and interrupt me or type your question in the chat and I'll be more than happy to get to it. If at any point you need to step away from your computer, just join us back when you can. And I also want to make sure that everybody feels comfortable and safe in this conversation. So if at any point you want to share anything, everything will remain confidential with me, and I would like to extend that same offer to the rest of the group. So if everybody agrees to keeping this session confidential, would you please give me a thumbs up? Great, it looks like everybody gave me a thumbs up, so this conversation will remain confidential. So when we talk about HIV treatment, I think it's really important to note that there isn't a cure anywhere in the world for HIV, but there are life-saving treatments available that ensure that someone can live a long, healthy, and happy life. And then another important outcome to treatment is that treatment makes it impossible for an HIV positive person to transmit the virus to someone who is HIV negative. But the only way to get access to this life-saving treatment is for someone to know their status, and the only way to know someone's status is to get tested. So we like to say that if you get tested and know your status, then you can get access to these life-saving treatments if needed and break the cycle of HIV transmission. So does anybody know what ARV stands for? ARV actually stands for antiretrovirals. So these are drugs that work in the body to lower the amount of HIV in the body. And it's a 3-drug cocktail that reduces the amount of virus by stopping viral replication. And this can lead to viral suppression or an undetectable viral load. And if virus replication is suppressed by in an HIV positive person, then the HIV will not progress to AIDS. But the only way to get access to these ARVs is for someone to know their status. So again, get tested, know your status, get access to these life-saving treatments if needed, and break the cycle of HIV transmission. So anybody that tests positive for HIV should begin taking ARVs as soon as possible. These are a medication that is taken daily, at the same time every day, very similar to birth control. A medication taken daily that takes about 10 seconds to take. And something that's really important with ARVs is that the drugs are taken on time every time. So someone who is HIV positive needs to take their treatment consistently in order to reduce drug resistance. So for HIV to become resistant to ARVs, it has to replicate. But if a person takes their ARVs and the virus is suppressed, then it can't evolve resistance to the antiretrovirals. So again, we need to get tested, know our status, and get access to life-saving treatments if needed so that we can break the cycle of HIV transmission. I also like to point out that there are side effects to ARVs. However, the positive effects are so great, and if side effects are of concern or are occurring, then that would be a conversation the patient would have with their physician. So now that we've talked about how ARVs are life-saving and how an HIV positive person can live a long and healthy life by taking ARVs every day, it's really important that we also talk about how having a suppressed viral load means that the virus is undetectable and that the HIV positive person cannot transmit the virus to an HIV negative person. So if the HIV positive person uses or takes their ARVs regularly, then they're at a much, much lower risk for transmitting HIV. And if the virus is undetectable, then the virus is untransmittable. So I also like to point out when we talk about untransmittable equaling, about the virus being undetectable and it being untransmittable, is that treatment is also a form of prevention. So not only is it important for an HIV positive person to be able to live a long, healthy life, but it's also important to break that cycle of transmission so that someday we can have an AIDS-free generation. So again, get tested, know your status, and get access to these life-saving treatments if needed. I also want to talk about post-exposure prophylaxis. This is a medication that's taken 72 hours after possible exposure, which greatly reduces HIV transmission, and then that is called PEP, post-exposure prophylaxis. And there is also PrEP, which is pre-exposure prophylaxis, which is a medication that's taken every day by someone who is at a higher risk for HIV transmission. And again, medication that somebody takes daily. So I hope that you all feel confident in your ability to talk about HIV treatment. So just to wrap up, ARVs are antiretrovirals, and it's super important that we all get tested and know our status so that we can get access to these life-saving treatments if needed and break the cycle of HIV transmission. Thank you again for your time, and I hope you have a good rest of your day.